Blood pressure naturally rises and falls throughout the day, but when it stays consistently too high, it stretches and injures the lining of your blood vessels. Think of your arteries like flexible plumbing. When the pressure is too high for too long, the pipes start to weaken, harden, or clog. The result is long-term damage to the organs that rely on those blood vessels, especially the heart, brain, kidneys, eyes, and limbs. The heart is one of the main organs affected. When your blood pressure is elevated, the heart has to work harder to pump blood forward. Over time, the left ventricle, the heart's main pumping chamber, thickens, a condition called left ventricular hypertrophy. Initially, this is the heart's way of adapting, but eventually the muscle becomes stiff and less efficient. This can lead to heart failure. This is a chronic condition where the heart can't pump enough blood to meet the body's needs. Also, high blood pressure accelerates the process of atherosclerosis, which is plaque buildup in arteries. These narrowed heart or coronary arteries can cause chest pain or lead to a heart attack when completely blocked. Many patients only find out something is wrong when symptoms like shortness of breath, chest pressure, or fatigue start. But by then, damage has often been going on for years. Your brain depends on a steady supply of oxygen-rich blood. When the pressure is high, arteries in the brain can rupture or become blocked. This leads to an ischemic stroke, which is when a clot blocks blood flow in the brain. A hemorrhagic stroke occurs when a blood vessel bursts. High blood pressure also contributes to vascular dementia, a condition caused by long-term damage to the brain's small blood vessels. This damage impairs memory, attention, and decision-making. In fact, high blood pressure is now recognized as one of the leading modifiable risk factors for dementia later in life. Hypertension may also contribute to Alzheimer's disease. Chronic high pressure affects the blood-brain barrier, the protective filter that keeps toxins out of your brain. When this barrier breaks down, inflammation increases and the brain struggles to clear waste proteins like beta amyloid, which accumulate in Alzheimer's disease. Alzheimer's disease causes memory loss and dementia. So even without suffering a stroke, uncontrolled blood pressure can reshape brain structure in ways that impair thinking and memory. The eyes are full of tiny blood vessels that are highly sensitive to pressure. High blood pressure damages these vessels, causing hypertensive retinopathy. This may cause blurred or dim vision, retinal swelling or bleeding, and over time, permanent vision loss. Because these changes are painless and gradual, they often go unnoticed until irreversible damage is done. Many people discover they have hypertension during an eye exam, when signs of retinopathy are detected by their eye doctor. Your kidneys filter waste and control fluid and electrolyte balance through delicate blood vessels. High blood pressure damages these vessels, reducing the kidney's ability to filter your blood effectively. This leads to chronic kidney disease, which often causes no symptoms until function is severely impaired. Over time, this may progress to end-stage renal disease, where dialysis or kidney transplant becomes necessary. In fact, high blood pressure is the second leading cause of kidney failure in the US. Hypertension contributes to peripheral artery disease, where narrowed arteries reduce blood flow to the legs. This can lead to cramping or pain with walking, cold feet or poor wound healing, and in severe cases, infections or ulcers that may require surgery or even amputation. Aneurysms are bulging weak spots in the artery walls, such as in the aorta, the body's largest artery. If an aneurysm bursts, it can cause internal bleeding. High blood pressure is not just a risk factor, it's a disease that affects virtually every major organ in the body. It often causes no symptoms until serious or irreversible damage has already occurred. That's why routine blood pressure monitoring is essential. If you've been diagnosed with high blood pressure, follow your treatment plan, take medications if prescribed, reduce salt intake, avoid tobacco, and be physically active. The goal isn't just to lower the blood pressure numbers. The goal is to prevent heart failure, stroke, blindness, kidney failure, and cognitive decline. Thanks for watching. If you found this video helpful, please like and subscribe. Also remember, this is not medical advice. Share this with someone who may benefit.